We take your questions to the doctor, and the doctor is in. We're joined by University Health Dr. Leo Lopez now, who's joining us to take your questions. And a big topic lately has been RSV.
Yeah, we want to start with that because we know that there are more cases. University Health is seeing more cases right now. So talk about what you're seeing in terms of symptoms, and especially something I want to get across is when is it time to get some help? Because this is another respiratory illness that a lot of times shares symptoms that so many others do.
I appreciate the question. So just to kind of level set, RSV is short for the respiratory syncytial virus, and we are in the middle of RSV season. So we are seeing a rise in cases, and we'll expect to see that throughout the fall and the winter. And so some of the more mild symptoms that we can expect are things like cough, congestion, runny nose. But we can also see some really bad and more severe symptoms: shortness of breath, wheezing, difficulty breathing. We can see, children with decreased activity and just not looking like themselves. And so it's always good advice to go see your doctor if you ever feel that there's anything wrong. But particularly for those more severe symptoms, you want to see somebody with some urgency. Because what we do know is that for most adults, RSV might feel like a bad cold, but for really young infants and for older adults, it can get really bad, so bad that you might end up in the hospital. And this condition can be life-threatening as well.
And that's things like struggling to breathe. I mean, something more than your typical respiratory illness symptoms.
That's right. So struggling to breathe, like increased work of breathing, but also looking like you've got decreased activity and lower energy. Those are all signs that should indicate we've got to get to the doctor to get checked out.
We have some other questions I want to get to, but quickly, there's a vaccine out there. Is it widely available?
So it's an important question. So we know that supply is currently limited for infants, but there are products available for both older adults, pregnant women, and these younger children. So if you're 60 years old and over, definitely connect with your doctor to see if this is the right option for you. If you're pregnant, between 32 and 36 weeks, there is a vaccine available so you can pass on this immunity, this protection to your child. And then for younger infants, there's also another immune protecting type of product to help them be protected from RSV.
Yeah. Okay. Let's get to some of our viewer questions we know we have here tonight. The first one is from Donald, having to do with diabetes on this one. He is asking, how do you encourage a person with diabetes to lose weight, and can insulin actually cause you to gain weight?
I appreciate the question. I think it's first important for us to recognize that diabetes is a global health crisis. In fact, about 500 million people around the world have diabetes, and that number is projected to increase to over 1 billion in just the next few decades. And the number one driver of these cases is the condition of obesity, or having a body mass index of 30 or greater. So I think the question asks about weight management. So there are some things that folks can do today to start to make some changes related to weight management, and they start with our diet. So if you are consuming sugary beverages like lemonades, teas, sodas, juices, that sort of thing, maybe identifying one day next week to where you say, that day, I'm going to cut out some of those sugary drinks. And those small wins will add up over time and can really benefit your health. You also want to try and get in at least 5 servings of fruits and vegetables every day. Again, starting slow and building up to where this becomes part of our routine and part of our lifestyle. You also want to try to eliminate eating too much fast food, sugary snacks, and salty snacks, that sort of thing. And then exercise is really important too. Trying to get in at least 30 minutes of exercise 5 days a week if you're an adult. But I know this can be overwhelming to start to put into action. So we encourage family members, communities, neighborhoods to work together, motivate each other, inspire each other to make these small changes, so that way we as a community can start to see some larger impact.
A 30-minute walk, as simple as that.
Exactly.
Yeah.
That would be really beneficial.
All right, so next question has to do about caffeine and coffee. Sure. Why does coffee, this is from Will T, why does coffee affect my energy level so drastically throughout the day? I want to take it to another level here and say, There are people who will drink coffee throughout the day. Some people have 2, 3, 4 cups of coffee. Is that a bad thing for your health?
I appreciate the question. And so for the 150 million Americans who are drinking coffee every day, this is particularly relevant. So we know that there are benefits and some side effects from the caffeine aspect of the coffee. So caffeine is a stimulant, so it can increase our mental energy, kind of sharpens our focus a little bit, increases our concentration, that sort of thing. But having too much can actually make us feel a little agitated, anxious, and on edge. And then there's the withdrawal aspect of it, where we can see some lower energy and that sort of thing. But I'd also encourage folks to, or at least to recognize that there are other things that can cause low energy. So while the viewer may be attributing the low energy to the caffeine or to the coffee, definitely encourage them to follow up with their doctor to get a full evaluation of their symptoms. And then to the question about the bad thing, of whether this is bad or not. We suspect, or it appears, that a safe level, generally speaking, of caffeine is about 400 milligrams of caffeine per day. But again, we want to ensure that folks are connecting with their doctor for that full evaluation. There can be other things that are causing low energy, things like anemia, thyroid problems, diabetes, those sorts of things, to name a few.
Yeah,
Right.
Caffeine affects us all differently, right? Okay, our last question here is from Anna M. She says, I am 65 years old, just diagnosed with osteoporosis. What doctors should I see for help? So
osteoporosis is a condition of having weak bones, and this can be really dangerous. We worry, one of our main concerns is breaking a bone. Having a fall, breaking a hip, breaking a leg, breaking a bone in your back, that can be life-changing. It can impact you just getting around the house or around the yard. And so we want to take steps to try and prevent that. So there are a few things in consultation with a primary care doctor or a specialist called an endocrinologist that folks can do to help treat and care for their osteoporosis. And one of those things includes, again, nutrition. We want to make sure that we're getting in enough vitamin D as well as calcium in our diets. We want to incorporate some strength exercises and balance training as well. We want to try to avoid smoking and drinking too much alcohol. And then in consultation with a doctor, they might consider a type of medication called bisphosphonates that can also be helpful. So definitely encourage folks to circle back with either their primary care doctor or their endocrinologist for a personalized treatment plan.
All right, Dr. Lopez, University Health, thanks so much for being here. We appreciate it.
Thank you.
It's good to finally meet you. I mean, you've done so many of these, and I've been off when you've been here. It's nothing personal.
Pleasure to connect.
All right. Thanks, Doctor. Doc Talk every Thursday at 6:30. We'll be right back.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.